Sponsors. Good afternoon, and welcome to Forever Young Med Spa's Simple Aesthetics radio show, where for the next hour, we will seek to demystify the world of aesthetics and provide to you, our listening audience, a non-medical opinion on what's hot, what's not, and what works based on our experience of performing over 22,000 treatments since 2005. The views provided on this show should not be considered medical advice, but rather the opinion of the host who has been in the medical aesthetics business since 2005. During this program, we will highlight some of the best new and tried and proven FDA-approved services and go over the technology, how and why it works, results you can expect, and take your questions live on the air. If you have a question you'd rather email, please send it to brian@foreveryoungmedspa.us. And now, here's your host, Brian Sedella.
Good afternoon, South Florida. Welcome back to another Simple Aesthetics radio show from Forever Young Med Spa. I'm your host, Brian Sedella, and I think we have on the line already to join us our medical director, Dr. Jeffrey LoGrasso. Dr. LoGrasso, are you there? Live radio. This is fun sometimes. Okay, so Dr. LoGrasso, are you there? There you go. It must be one of those bad cell connections we're so famous for.
Hey, Brian, how are you?
I'm good, Dr. LoGrasso. How are you?
Excellent.
Well, thank you for joining us. I know you're very busy with surgery today, and glad you had a quick 15-minute break so we can discuss some things that we keep getting a lot of questions during our surgical consultations for what type of prescriptions and over-counter medications patients should avoid prior to surgery. So I thought we could probably share that with our listening audience and our viewing audience because it's a very frequently asked question. So what should patients avoid prescription-wise and over-the-counter medication-wise prior to surgery?
Well, the main things that we want people to avoid prior to any surgery are things that are going to cause issues with our surgery. The main one being bleeding. So, any medication that can affect the platelets or affect your risk of bleeding, things such as the non-steroidal, such as Motrin, ibuprofen, Advil, Aleve. The other one would be, aspirin, which increases your bleeding time. Any of the anticoagulants, like Coumadin, warfarin, Plavix, Lovenox. So anything that can increase your risk of bleeding, obviously that would be detrimental to surgery. And then one of the other ones, that we're looking at are, which vitamins or minerals out there can, increase your risk of bleeding. And there's a ton of them. And nowadays most people are taking some sort of a multivitamin, and they may not know exactly what's in it. So we recommend stopping, all of those medications 2 weeks prior to surgery, so that when we're performing surgery, we're not going to find something that's causing us some issues. The reason why most of these medications are harmful, like I said, they increase the risk of bleeding, but what they do is they affect the ability of the platelets, which is their main importance. The platelets' importance is to come together to stop anything that's bleeding from a blood clot. When the platelets are not functioning, it kind of bleeds from everywhere, so it's very difficult for us to stop. Usually during surgery, when we're making an incision, we're using this electrocautery device called the Bovie, kind of a electric current heated knife. If you see anything that's bleeding, we stop it. Sometimes when people are on these medications, these anticoagulants or these medications that affect platelet function, it gets used from everywhere. So it's extremely difficult during surgery. And even though we can stop it during surgery, it puts you at a risk for increased bleeding after the operation, which is something that nobody wants to do during an elective surgery.
So does it affect the healing time as well? Like if a patient is, didn't tell you that he or she is on Advil, will it affect the actual healing time for the patient?
Well, it affects the healing time only in the sense that, if there's more bleeding, you could be more bruised. It may require us to go back in there and drain the blood that's accumulated. So it'll only affect the healing time that way. It's not per se going to make you feel slower if you don't have a complication from the extra bleeding, but if you have a complication from the extra bleeding, it's definitely going to affect the healing time.
And are there some specific supplements? A lot of our patients come in being on these different types of fish oil or krill oil. What supplements should they avoid prior to surgery?
I pretty much keep it simple, and I tell patients just to avoid, all the vitamins and supplements for 2 weeks prior to the surgery. Like I said, a lot of these things are a combination of things. The main ones that we're looking at are the fish oils, which has been shown to increase the risk of bleeding, like ginkgo biloba, which is something that people use to, increase memory and increase, energy and stamina. Those are some of the main ones out there. But, with any of the herbs or herbal medications or homeopathic medications, you just don't know sometimes. In counter argument to that, there are some homeopathic medications that we do like for patients to take prior to an operation because they have been shown to be beneficial. One of them is Arnica montana. Arnica montana is a homeopathic medication. You can find it in any GNC, any Whole Foods, any natural health store that's been shown to decrease the risk of bruising, decrease the risk of inflammation and swelling after an operation. Typically, I have people start taking that 3 to 5 days prior to the operation so they can get the levels into their system and for a week or two afterwards. Another one will be bromelain, which is a compound found in pineapples, has also been shown to reduce swelling and to reduce the ability of the person to bruise. So those are some medications that you can take prior to. Also, you can start taking some vitamin C. Vitamin C is important for the production of collagen, which is a building block in the body. So taking extra vitamin C prior to surgery has the potential to have recent success there. This is one of the areas of surgery that we're kind of always looking for things that can expedite the recovery process, slow when a return to work as quickly as possible, and minimize adverse effects.
Okay, so 3 commonly or over-the-counter medications or supplements patients should take prior to surgery: arnica, bromelain, and vitamin C. Any dosage information on that? Like, should a patient start taking 1,000 or 1 gram of vitamin C a day? Or
the vitamin C, I'll have to take 1,000 milligrams 2 times a day. It's water-soluble vitamins, so it can't cause any issues. Anything extra, you'll just excrete through your urine. There's so many different milligrams and compounds in the arnica, so depending on which one that you want, it's hard to answer that question. Typically, if you go to Whole Foods, and that's typically the one that I prescribe the most, it's going to be 3 capsules, which are placed underneath the tongue, and it's 5 times a day. I start that 3 days prior to the surgery. And the bromelain, typically it's 1 pill 3 times a day.
Okay, excellent. I've also read or heard someone talking about vitamin E being something we should avoid prior to surgery. Why is that?
Once again, it's one of those vitamins that have been, loosely shown to possibly increase the risk of bleeding after an operation. So, vitamin E is also a pretty potent antioxidant. It could have some beneficial effects, after the operation. And, I have people stop these vitamins 2 weeks prior to, but I allow them to start taking them again, 2 or 3 days after the operation when any additional, chance of acute bleeding is present. Because I think that, some of these vitamins and minerals can actually be beneficial for the healing process as far as, what's going on in the body and all the biochemical pathways.
One kind of question that we keep running into as well is why is smoking so bad prior to having surgery? So why should a patient quit smoking before they decide to have a cosmetic procedure?
Smoking in general is just toxic for the body, but it has specific profound effects on the skin. What smoking does, and it's a combination of the tobacco and the multitudes of compounds which are hazardous to our health found in the tobacco and cigarettes, it actually decreases the circulation to the skin, so that during any sort of an operation where we have to create flaps of skin or we're moving skin around, it actually increase your risk of that skin dying. An operation such as a facelift, such as a tummy tuck, or a breast lift. Oxygenation to the skin and having blood supply to the skin is very important because it brings the nutrients there. If you cut down the blood supply, you can die. So you have to stop smoking a minimum of 2 weeks prior to any operation, and for at least 6 weeks afterwards. I prefer a month. The longer the nicotine and the cigarettes are out of your system, the better. And that's just something that it's healthy to do. I mean, smoking is not good for you in any way, shape, or form.
Well, it sounds like it'd be a great incentive for a patient who's a smoker to quit, because as Dr. Lagrasso just said, you're going to get a better result, less complications. Now, will you operate on a patient who smokes?
No.
Well, there you have it. I know you're in process of writing a book. How soon before that comes out, and what's the topic going to be?
The topic is going to be how plastic surgery is not just surgery, but is more of a lifestyle, how it has to encompass, wellness and nutrition, so it can be based more upon that aspect of things than on the actual surgical aspect of things. And, I should be probably complete by the end of the year, hopefully. I'm very big into nutrition and proper diet and lifestyle changes, and I think that's kind of the most important thing. And me being a person who kind of specializes in liposuction and body contouring and other things that I'm very good at. And a lot of the people that come in are overweight, and it's part of the counseling process that I kind of go through with them, to instruct them how to eat properly, so that, one, some people may need to lose weight prior to the operation to get down to a weight where they can be operated on, or, two, we want to maintain the results that we're getting and to live functionally. It's a shame that, people perform an operation and, you look beautiful from the outside, but you're not beautiful from the inside, and that you're toxic. And, you're creating lots of inflammation from a diet that's, abundance of carbohydrates and gluten and, just all of the wrong foods. So I think that, the combination of both is going to give the lifestyle choices that people need to make.
Yeah, we've already seen, just in the past couple of years, patients coming in for repeat, or as they call them, it's time for my tune-up, I got to get some fat out, and that's not what they should be doing. They should be getting the fat out once and then making some lifestyle changes to make sure they don't got to go through this again.
Absolutely.
Okay, well, Dr. Lagrasso, I know you're very busy. I want to thank you for joining us. To reach Dr. Lagrasso, please call the number 954-450-2626. What's on your schedule this afternoon, Dr. Lagrasso? What type of surgery are you doing this afternoon?
Today we did a couple of breast augmentations, we did a couple of tummy cuts, and I just finished up my last surgery, so just see a couple of patients and then go from there.
All right, well, thank you again for joining us, and we'll have you on again next week, or if you time permits, and looking forward to having you on when your book comes out as well.
Have a great show, Brian.
Thank you, Dr. Lagrasso. Okay, we're going to take a short break in a minute and come back with a very, very special in-the-studio guest, David Pataka from Syneron, going to be discussing the new Syneron E-Matrix for skin rejuvenation. We'll see you back after the break.
Turn back the hands of time with South Florida's #1 medical aesthetics center, Forever Young Med Spa. Have you ever wished you could turn back the hands of time? Lose those lines and wrinkles and enjoy the healthy, flawless skin you had during your younger years? Ever wanted to rid yourself from hair under your arms, on your legs, or around your bikini area? Or men, the hair on your backs? Well, now you can at Forever Young Med Spa, where we provide the latest surgical and non-surgical procedures and rejuvenation products to restore your youthful skin appearance and enhance your self-image. Under the direction of renowned board-certified plastic surgeon Dr. Jeffrey Lagrasso, our staff of highly trained and certified professionals will meet with you to go over your goals and recommend services that best fit your lifestyle, your budget, and your expectations. So no matter if you're looking for surgical procedures such as Vaser high-definition body sculpting, a mommy makeover, or non-surgical services such as the latest FDA-approved injectables, Vanquish body contouring, Exilis Elite for skin tightening, or our Hydrafacial MD treatment for your face, you can relax and let Forever Young Med Spa complete your journey towards a younger, more vibrant-looking you. Call us now and schedule a complimentary consultation at 954-450-2626. That's 954-450-2626. Or for more information on all our services, please visit our website, www.foreveryoungmedspa.us.
Welcome back, South Florida, and I'm pleased to have in the studio today a very special guest, David Pataka, who's the rep statewide for Syneron. Syneron is who I classify as one of our strategic partners at Forever Young Med Spa. We've used their technology since, way back in 2005, when people used to poo-poo us for using RF energy. How times have changed. David, welcome to the studio.
Thank you. Good afternoon, Brian.
Why don't you tell our listening audience a little bit about yourself?
Sure.
And also some contact information if any physicians are looking to get some equipment in their office.
Sure. I've been down in Florida for over 20 years. I've been fortunate to be with Syneron and Candela, originally Candela, and then with the consolidation with Syneron and Candela since 2007. Before that, about almost 8 years with Takeda Pharmaceuticals, so in the medical field, calling on physicians for quite some time. And the last, the joke is in the energy industry, 1 year equals 7 like dog years, just because of the way this is. But yeah, originally from Jersey, been down here since 1989, so I'm a Florida guy.
So you're about 185 years old?
Only on the inside.
I know that feeling. Well, David is honestly one of the really good guys in this business, and I say that with all sincerity. David not only cares about the customer before the sale, but he cares about the customer and the patients after the sale. So thank you for all your help over the past couple of years.
My pleasure.
So we're going to go into a product called the E-Matrix, and you may have heard our staff talk about ablative rejuvenation. And Freddie, if you can start rolling into the slide that says, what is ablative rejuvenation? And David, I'm going to have you describe this slide, if you could.
Absolutely. For me, E-Matrix or the trade, ablative rejuvenation, it's quite simply comprehensive rejuvenation in a one-stop treatment. We're fortunate with the size of our company and the consolidations. We have about 28 to 35 different devices. Personally, the ablative E-Matrix, that's one of my favorites because it's comprehensive in its approach to addressing a whole host of issues that women and men have with their skin and every single treatment. So I don't need multitude of different devices. So ablative rejuvenation, it's FDA cleared to treat all color skin, which is very nice. I cover the Caribbean as well as Florida. So right now in the United States, 37% of the United States is comprised of ethnic skin. By 2020, it'll be about 40%. I think by 2040 or 2050, it'll be over 50%. And it's important to be able to have devices and technologies that are FDA cleared to treat that skin aggressively and yet safely, so they can get the best results.
And what's the significance of that is if you're using a laser or a light-based device on a patient who's dark skinned, what can happen?
The complications, unfortunately, that we see the most, the laser and the lights, depending on what wavelength or what type you're using, it could really burn. It could actually pull out the pigment of that dark-colored skin, and unfortunately, and sometimes that could be permanent. Thankfully, there's so many great physicians down here that they can try and mediate that, and if they catch it soon enough. But unfortunately, we do see a lot of permanent scarring and permanent hypopigmentation as well as hyperpigmentation.
And the difference between hypo and hyper for the listening audience?
Hypo is when you destroy the skin cells, the melanocytes, that give your skin that nice complexion, whether it's olive or when you get a suntan, and you're essentially burning them with the wrong color laser, and they can no longer function, they're dead, and that skin basically turns white. And hyper is an excessive production of pigment. So I always say your skin cells are having a party. They want to produce color, kind of like when you're out in the sun. That's how you get a tan. Sometimes if you use too much laser or too much energy, they overproduce color. And there you have hyperpigmentation. Usually that can resolve itself within 6 months, and oftentimes much sooner because of a lot of different cosmeceuticals that are used to help address that sooner for the patient.
And for our audience, again, the fractional RF from Syneron, the E-Matrix, doesn't use light.
Correct.
So what does it use?
So it's we use fractionated bipolar radio frequency, which is a fancy way of saying electricity. And what's great is one of the inventors of this product, back when it was invented, was a 28-year-old gentleman with 3 math degrees, Mr. James Bartholomew, and the whole concept was, how can we get the results that patients are looking without subjecting them to the potentially more dangerous aspects of lasers and lights, which can be unpredictable at some times, especially, again, with more ethnic skin. And in a simple phrase, it's all about causing a controlled, loving injury, and I always use the word loving because that's what we're doing, in a volume of tissue on your skin, putting that skin into a wound healing mode, so it's constantly stimulating new collagen, and with E-Matrix, even elastin, which we'll go into later, I know.
Okay, Freddie, can you go to the next slide? And this slide is going to depict what a typical fractional laser treatment, whether it's a 2940 or a CO2, does to the skin. And as you can see from the slide, and if I'm missing anything, please let me know, David.
Absolutely.
The energy is going straight down uniformly from top to bottom. And if we could now switch slides to the next one, Freddie, and I'll have David describe this, the cone versus the pyramid, and what the impact to the patient is on this.
You know, this is the beauty, and it's just pretty genius in how it's doing. The whole concept of subablative rejuvenation is minimal epidermal impact. So that's to say, with a traditional laser or CO2, if you want the most results, we have to vaporize, if you will, more top layer skin to drill that heat all the way down, or to drill the light all the way down to cause more of an injury, so we can cause more healing. With E-Matrix, we don't need as big an opening in the top of the skin. It's actually less than 5%. So that radio frequency just opens a little latch in your skin, and as soon as it runs into your skin, it spreads out to the distance of the electrodes, which are on the actual tip that's pressed up against your skin. So we can actually cause and treat more volume of tissue than a CO2 safely, with minimal epidermal impact because of the radio frequency, electricity.
So looking at the slide, on the right-hand side of the slide is how the E-Matrix actually works. So if you can picture the very top of this inverted pyramid, that's the top of your skin, and you can see the energy spreads out much deeper and wider underneath. And that's what you're talking about in terms of sparing the tissue on top?
Absolutely.
Okay.
Absolutely. And so you're getting maximum dermal remodeling with collagen in the dermis, which is where all the collagen, which is where all the women and men want their, the tightening, without disrupting or causing too much downtime or negative adverse events on the top of your skin.
And what are the FDA approvals for the E-Matrix?
E-Matrix is FDA cleared for acne scarring, tone, texture, and laxity. There's obviously more benefits beyond FDA clearances, so a lot of the physicians throughout, not just the country, but Syneron Candela is based in over 100 countries. There are other treatments they're using for pore size. The results in pore size are pretty dramatic. We had a workshop back in May down in Coral Gables. We had about 7 speakers. Dr. Flor Mayoral and her daughter, Dr. Janelle Vega, were showing their recent pictures for stretch marks. Pretty impressive in terms of what it can do. And we never use words like eliminating. We're talking about blending, fading, but the concepts, especially with stretch marks in particular, is E-Matrix is one of the first devices that came in that actually has histology and peer-reviewed papers for showing not just collagen stimulation, but elastin. So as it's been explained to me, the beauty with elastin is we stopped producing that at about 19, 20 years old. So now we have a product, and there's been others since then, but now we have a product that is literally getting more into reversing aging process rather than just delaying it, and addressing the core issue of stretch marks, which is the stretched out elastin fibers.
And for our listening audience, elastin is kind of like a rubber band. And as you're younger, you can stretch that band and it'll snap back into place. Over time, as we age, when you pull back that skin, it kind of just stays there.
Yeah.
So having a product that can, in fact, create a new elastin fibers is the first time in the history of aesthetic medicine that's been proven to be the fact with a device like the Matrix RF. You mentioned pore size. Kind of interesting. The most frequent comment that we hear, and that I hear, from women especially getting the E-Matrix done, is how well their makeup goes on afterwards.
Absolutely.
And how much easier it goes on, and how much prettier the skin looks with makeup. We're curing their fine lines and wrinkles, getting rid of their pore size, and the most common comment we hear is, "Oh my God, my makeup goes on so much better."
Yeah.
Why is that?
Simply, it actually, from the heat, it actually neutralizes or calms down the oil production from your oil glands. So you might have less oil, so the makeup can glow on better. That's the number one response. And energy devices, by and large, all have some effect to that in terms of calming down the sebaceous glands, the oil glands, less oil production. But E-Matrix, it has to do with more heat. E-Matrix at the top of the skin is about 110 degrees Celsius. That's a lot of heat, safely, lovingly, like I always say. But that type of heat has a more magnified impact in calming down the oil glands. So it makes sense.
Yeah, and the shrinking of the pores, I'm sure, helps as well.
Yeah.
Can we go to the next slide, Freddie? So this is one of my favorite features of the E-Matrix. Is it's not a one-size-fits-all; it's a customizable solution.
Absolutely.
So let's go over program A, B, and C and what that kind of means to the average patient.
Sure. The great thing about this product is exactly as you said. We're able to customize not just the amount of energy we're delivering into the face or the neck or the abdomen, but also how deep we're going with the energy. So on program A, we're basically looking for a light dusting, if you will. More aggressive than a microderm. We're dealing with a lot of tone textural issues. You get some, maybe some light pore size, but when you start seeing what the magic, and I hate using words like magic when it comes to the medical and aesthetic field, but B and C is where our depth, how deep we're going into the actual layers of the skin. With the B setting, we're going deeper. It's technically about anywhere from 1 to 300 microns. And why that's important, not to get too technical, is clinically proven 1 to 300 microns allows the skin to be impacted in a good way for tone, texture, and pigmentation. On a C setting, we're actually going into the upper dermis. That's a millimeter deep. All the good things that we want for collagen and laxity do not happen unless you go into the dermis. So on somebody's face, typically, let's say you're treating a female patient, maybe they have Botox on the forehead. Depth of penetration or the amount of heat on the forehead, probably not as much of a concern because it's pretty smooth. So you're able to customize the energy and back off appropriately with maybe an A or B setting. The areas that most people obsess about, men and women, around the eyes, under the eyes, even above the eyelid, around our laugh lines, upper lip lines, things
acne
like that.
Scars.
Acne scarring, absolutely. Acne scarring. The way it was explained to me by a physician out of Tennessee was when we use fractionated CO2 lasers, which are the godfathers in this industry, but a lot of downtime, only for light skin.
Wound care.
Wound care, absolutely. A lot more hand-holding.
Yes.
You have to make sure you're over the scarring when you're drilling or vaporizing that tissue. E-Matrix is wrapping that fibrous scar tissue underneath in an even 360-degree current. So it's slowly degrading and breaking down that scar tissue. And then the little Pac-Man of our body, the little macrophages come, nibble away at it, make it easier for the body to heal uniformly.
And I promise everyone we're going to get to some really incredible before and after pictures in a few minutes, but and seeing is believing, and what David just described you're going to see happen in these pictures. Next slide, Freddie, please. So the skin healing process, what happens and what is the kind of downtime most patients experience with the E-Matrix?
Sure. In the world of vanity or aesthetics, red is our friend. Inflammation is our friend. So that's the healing process. So on a typical setting, which involves a B and C, which is variable depths, but a real world, it's on the face. It's 3 to 5 days of maybe just some crusting, but really it's only 24 hours of social downtime. The nice thing about this is a sealed wound. There's literally no risk of cross-contamination, so we do have patients that put on foundation to cover it up after, because immediately post-treatment, more like a sunburn, and then the healing, what we call the reepithelialization of that treated area over the next 24 to 48 hours, we call it therapeutic microcrusting. It's a nice $10 word for a little sandpaper effect. But you're able to cover it, conceal it, and then let that naturally exfoliate. When we do off the face, it could be maybe 7 or 10 days, depending, just because we heal slower off the face.
What's amazing, in having done probably a few thousand of these treatments over the past
That's it?
6 years. And I think I mentioned this before on the air, is that every patient is different. This is the practice of medicine. These are not toys, and every patient is different. We've actually had patients who've been red as can be for like a red sunburn, but only lasts for an hour.
Yeah.
And other patients that last for a few days.
Yep.
But as you said, it's an easily coverable, post-treatment experience.
Yeah.
And let's go into some of the pictures. Next slide, Freddie. This is directly before and after treatment, and you can see clearly the sunburn kind of effect that David described. Anything you want to add to this photo?
Yeah, I mean, it's a uniform coverage in terms of treatment. Immediately while the provider's doing the treatment, you know exactly if you missed an area or if you didn't because of the footprint, and a little bit of red is okay.
Red is your friend, and as David said, and you can see the little microscopic. Hopefully, those on TV can see this. It looks like grid marks almost on the patient's face.
And those are the channels. Those are actually the vaporized microchannels of the electrical current that needed a pathway in to go deeper into the skin. So it's only natural that will begin to form a scab, although we don't like that word, but that's essentially what it is. But that's positive. That's the healing.
And actually, the scabs, we've had very few patients actually get a physical scab. You'd have to really get a magnifying glass out to look to see those type of scabs. It's really very hard to see.
Yep.
Next slide is actually a gentleman, and by the way, guys, we have a lot of men that get this treatment done. It's fantastic for pore size, for fine lines, acne scars. A lot of men are coming in for acne scars for the E-Matrix. So I think you can see clearly this is before one treatment, immediately after one treatment, and then 1 and 2 days post-treatment. And obviously, as a guy, he's not wearing any makeup, and you can see it doesn't look that bad. And again, as a guy, no makeup, you can definitely go to work after this after 1 day.
Yeah, it's a little sunburn, and you could use a tinted sunblock. So if you don't want to ask your spouse or significant other for makeup, you could do a nice little tinted sunblock is fine. But the other thing for men, because it's actually that market, historically when you look at objective websites like ASPS.org and other statistically quantified data, the women aged 25 to 55 make up 94% of the market. The male demographic is getting larger and larger, and one of the drivers to that, because there are always psychological aspects behind certain treatments and why they're surging in demand and popularity, it's the economy.
Right.
To look more youthful, to maintain a job, or to secure a job.
We talked about that last week. Our fastest growing segment are men and women between the ages of 20 and 30.
There you go.
The women between 20 and 30 are coming in because they don't want to look like their mom and grandma. The men are coming in a little older, usually between 35 and 45, maybe even 50, because they want to look good for promotion, or they're trying to re-enter the job market and look their most vibrant.
Yep.
Okay, next slide, Freddie, please. And this is that same person that we had on 2 slides ago. Again, immediately post and then 5 days after. And this is, again, without makeup. I wanted to show how this person looked without makeup. And the healing is going on. You can see the reddening from a pretty significant sunburn to almost just a casual afternoon at the beach has been a tremendous improvement.
And sometimes that red is going to be more magnified if you have a patient that is on a Retin-A, and maybe instead of stopping it a week before or 2 weeks before, like we would prefer, maybe they forgot and they just stopped it the night before. So the tendency for that skin to become more irritated, more red, it's natural. It's not a bad thing. It's okay. And a lot of the providers know how to maybe help conceal it with a lot of the cosmeceuticals out in the market.
Color Science is very, very popular, by the way. It's one of the products we carry to cover with a colored sunscreen.
That's actually my favorite.
It's a great product.
Yeah.
You know what? We're up against a break. I think we're going to take a quick break and then maybe even try and finish the show out. Kind of going through these slides. We've got about 15 to 20 more to go through. So we'll take a short break and we'll come back, and we'll be back with David Ptaka talking about the Syneron E-Matrix Skin Rejuvenation System. Actually, you know what? We're going to continue because our booth guys are gone. Are they at a coffee break? You know, I used to always watch live TV and say, come on, it can't be that hard. They're back now, so we're going to take a short break and get back with David Pataka after this next 60 seconds. Thank you very much.
Turn back the hands of time with South Florida's #1 medical aesthetics center, Forever Young Med Spa. Have you ever wished you could turn back the hands of time? Lose those lines and wrinkles and enjoy the healthy, flawless skin you had during your younger years? Ever wanted to rid yourself from hair under your arms, on your legs, or around your bikini area? Or men, the hair on your backs? Well, now you can at Forever Young Med Spa, where we provide the latest surgical and non-surgical procedures and rejuvenation products to restore your youthful skin appearance and enhance your self-image. Under the direction of renowned board-certified plastic surgeon Dr. Jeffrey Lagrasso, our staff of highly trained and certified professionals will meet with you to go over your goals and recommend services that best fit your lifestyle, your budget, and your expectations. So no matter if you're looking for surgical procedures such as Vaser high-definition body sculpting, a mommy makeover, or non-surgical services such as the latest FDA-approved injectables, Vanquish body contouring, Exilis Elite for skin tightening, or our Hydrafacial MD treatment for your face, you can relax and let Forever Young Med Spa complete your journey towards a younger, more vibrant-looking you. Call us now and schedule a complimentary consultation at 954-450-2626. That's 954-450-2626. Or for more information on all our services, please visit our website, www.foreveryoungmedspa.us.
Welcome back, and we have a lot to go through, so we're going to get right to the next slide, and hopefully everyone's logging in so they can see these slides, which are really, really incredible. Freddie, go back one, please. And what this slide is going to show, it's this one here, is kind of two pictures. One on the left is a patient's skin before treatment. And as you're looking at this, it's kind of weird looking, but if you look at that very top of the frame, that's the skin, and below that is what David just said, is a scaffolding that holds that skin up. And then you'll see the second slide, which is 6 months after the treatment. You can see the new collagen, the new elastin fibers being built. They come up to the skin that increase the volume, and reduce the laxity of the skin, and also smooth out the lines and wrinkles. So David, I probably took all your thunder there, but go ahead and add to it if you want to.
No, I give you an A+ on that description. You know, the simple concept is, as we get older, our collagen, just through aging, and turns into an accordion. So it's basically collapsing upon itself, and anytime you want to build a home, you want to start at the foundation, so you don't want cracks in your foundation. So what we're doing is we're remodeling, we're rebuilding those collagen bundles and giving more volume to the surface or the area of tissue that we're treating.
What is that white stuff in the area of blood supply? What exactly is that?
Those, I mean, you've got a lot of different structures, but you've got collagen mixed in there. You've got elastin, a lot of vascular supply, and we're starting a whole process of healing. And you know, the result 6 months out, because you know the 6-month number is very important, because when patients get this treatment, optimal results are seen 4 to 6 months out. A lot of times that's the balance is expectations. Usually we don't present with our issues because they happened overnight, nor are the results. But in 2,500 patient clinical trial initially, 70 to 80% of all the patients treated with E-Matrix commented on immediate changes with tone, texture, pore size, some light pigmentation in terms of superficial sun damage. But in terms of the collagen, it's the gift that keeps on giving. 4 to 6 months out is when you begin, and in terms of collagen, you don't even see the manifestation of those new collagen for at least 6 weeks.
And that's an excellent point, and we tell all our patients, not just for the E-Matrix, but for any RF device, you have to wait 4 to 6 months for your final result. And you can't expect 1 or 2 treatments to have a miracle occur, but we do see our best results 4 to 6 months
Absolutely.
afterwards.
Yep.
So next slide, ready, please. And kind of, I don't know if our listening audience understands what 200 microns is, and this slide is showing a 200 micron ablation.
Sure.
How deep is 200 microns?
Depending on the part of the body, but on average is about 6 millimeters of skin, 1,000 microns per millimeter. So clinically, in peer-reviewed papers, a lot of the dermatologists who've done, and the PhDs who've done a lot of this work, they know with pretty close certainty what is the optimal depth you have to go with energy to achieve the desired result of not only what the physician or the provider, but also what the patient's looking. So that A, B, and C setting on the E-matrix before, that correlates to this graph to where you're seeing a 200 micron depth of vaporization. That's a significant wound, but it's done in such a way that it's minimal in terms of the epidermal or the surface of your skin, the impact, but the majority of the heat is being delivered deeper out of sight, so we get more healing, more volume of healing. So, technically, I would say you could probably get a more magnified result than a lot of these other devices out there.
So that's that beautiful wound you talked about earlier.
Yep.
Now, in terms of how deep it's going, and trying to get an analogy, is it 1 human hair deep, 2 human hair deep? About how deep are we going at 200 microns?
I'm gonna hand that one back to you, Brian.
Well, it's about 2 to 2.5 human hairs deep.
Okay.
is how deep we're going. So
I have no hair, so you're asking the wrong guy.
Hey, I'm follically challenged myself, so I understand. And if you can't see Freddie, but he shares our pain.
It's all the brain cells.
So yeah, my point is, the patient, this wound, this slide looks like, oh my God, the person's got a gigantic cavity in their skin. This is magnified dramatically.
Absolutely.
So let's go to the next slide, Freddie. We're going to get to some before and after pictures, and we'll skip that next one and go to the next slide. I love this slide because you can see directly after, 30 minutes after the matrix treatment, you see a person who again looks rather sunburned.
Yep.
And then you see the same patient 24 hours later with conventional makeup, and you can't tell.
And that is with Color Science, but I know that for a fact because I know that patient.
Excellent.
So, yeah.
Color Science, again, for those who don't know what Color Science is, it's a medical grade makeup that has an SPF of 35 to 50, which is what we recommend. You've heard me beat over and over again the past 5 weeks on wearing sunscreen. Color Science is one of the best out there. We're proud to provide that since 2005. But the point of this picture is you can clearly see that this patient went back to work the next day, and no one's like, oh my God, what did you have done?
Yeah, it's concealed. And she presented before the treatment with really bad rosacea. So when you come to get a treatment with E-Matrix, and really with any technology, if you're coming with an existing chronic inflammatory condition like active acne or rosacea, it's only natural that your redness post-treatment is going to be more magnified.
Yes.
So everyone's skin is different. And just like what you were saying earlier, where some patients, the redness starts going away in an hour, I've seen that a multitude of times, and we just don't know how your skin is going to react. So we always say 24 hours of social downtime, and anywhere from 3 to 5 days of just the complete exfoliation of those little microcrusting.
Okay, excellent. Next slide, Freddie, please. And describe this one. I'll let you take this one, David.
Sure. What we're looking at is just an overall change in the tone and texture, some breaking up of that pigment, and this is a big thing. This is when women and men come to get a treatment, they're always asking for photorejuvenation.
Right.
Even though there's no light in this device, which is really nice. Photorejuvenation usually means something different to every person. But when you ask that patient, great, what concerns you the most, you usually get a laundry list, and on their top few items are the tone, the texture, pore size, some superficial pigmentation, laxity of the skin, and you could see just in the evenness of the skin, especially in the forehead area, the lighting could be just a little bit better on this picture, but it's just more uniform. And it looks like she has some melasma, which is a whole other animal unto itself, but it's a tricky.
Last week we had on the show Victoria Duke, who's a professional makeup artist to the stars, and one of the things she would bring out to me when I showed her before and after pictures is you want the skin to be luminous. and you can see a tremendous difference in the way light reflects off the patient before and after. And that's one of the things I notice is how much brighter her skin looks. So it's not just a tone and texture. Her skin just looks younger, more vibrant, more youthful, and
it glows.
It glows. It's beautiful.
And you know, the one thing we didn't, and it was my mistake with the E-Matrix, it's not just about the power behind the system. Radio frequency, again, fancy word for electricity, it's all about working in concert with the skin that you're treating at that time. So radio frequency, the machine will automatically self-correct the electrical current based on how thick or thin the skin is, or how tough the tissue is for acne scarring. So it's basically an autocorrect that's proprietary inside that machine. And that makes it exponentially safer when you're treating ethnic skin, because you're not bringing a shotgun to the field of play. You're working in concert with the skin. That's why I say a controlled, loving injury.
And if I was using a CO2 laser on this patient, the fear would be hypopigmentation,
yes.
and also after wound care.
Correct.
So next slide, Freddie, please. And David, you can go right ahead and take this as well.
This is what we were talking about earlier about acne and active acne and acne scarring. The heat of these treatments, and again, E-Matrix is not unique with this regard, but it's more magnified. It's all about using the heat to destroy the P. acne, also to calm down those sebaceous glands, and you start seeing pretty dramatic clearance. Of just active lesions, as well as the scarring, which usually goes hand in hand with the acne patient.
And again, the skin, the luminosity of this patient improved dramatically. Her acne improved. Even her eyes, she just looks brighter when you get your skin done like this. Next slide is of a moderate amount of laxity and also wrinkling and lines. And you can see for our viewing audience, it's about a 50 to 70% improvement in the overall laxity of the skin and fine lines and wrinkles. And that's without Botox, without fillers. We do have patients who come in and, for their own reasons, say, I don't want Botox, I don't want to inject anything to my face, what can you do? And the Matrix is one of our staples for those types of patients.
Yeah, and it will help put off the actual knife for a little bit longer, but being able to use it beyond just the face and on the neck area to tighten and smooth out some lines. And when you were talking about the efficacy in terms of how many results or what percentage, in theory, if you can get anywhere from 30 to 70% improvement, and usually the younger you are, the more improvement, that you want to be very happy with.
Yeah.
Very happy with. But usually you're in that 50 to 70% range.
We never tell patients that we can cure anything.
No.
Like acne scars, we're really, really happy with a 40 to 60% improvement, even though we can eventually get 50 to 80%. But we try and tell patients, let's go for 40 to 60% and see if it gets better from there. But I'm pretty comfortable that most patients we've ever treated, we can achieve a 40 to 60% improvement in those acne scars.
Yeah.
So next slide, Freddie. And this is of kind of crow's feet area. And you can see what a dramatic difference in the crow's feet. And again, I keep saying this, the luminosity of the patient's skin. Just beautiful.
Yeah, and any of those patients who are not novices to the world of vanity and energy-based treatments, the one thing that I hear automatically as soon as they're on the table is, what about my eyewear? Don't I need eyewear? No, you don't. And that's why we can get really close, right on top of the orbital rim in the eye, to do upper and lower lid, and which is what we're seeing here. This is just a little on the outskirts of that, but to be able to smooth out those lines, which is that is on the bullseye of a lot of people.
Very hard to reach, like you said, the conventional lasers.
Yeah.
Next slide, Freddie, please. And kind of the same thing. You can see a difference in the texture, the fine lines around her, the periorbital side of her face, and just a tremendous improvement.
And all these clinicals, the majority, they're all based on 3 treatments, which that 1 month apart. If we're treating someone with acne scarring, maybe someone 55 and older for laxity or stretch marks, sure, a 4th treatment in clinicals, a little bit more injury, a little bit more results, not a bad thing. But by and large, 3 treatments is what a lot of the results are based on.
And just so our patients know as well, unlike a lot of devices out there, each tip for the E-Matrix is a single-use tip for each patient. So there's no concern over infection being spread, or you get your own tip. Each patient gets a tip for each treatment. They cost a lot of money, guys, but we're glad Syneron engineered that because it's great for safety.
Sure.
Next slide, Freddie, please. Another picture shot of the eyes before and after.
Yep.
You can clearly see a tremendous improvement under her eyes and on the sides of her eyes, called typically referred to as crow's feet. Great before and after picture. The next slide is a little bit different. I talked about skin luminosity. David talked about improving the tone and texture, and you can see in this patient before and after what a spectacular improvement in her tone and texture.
After one treatment.
That's one.
That's one treatment, yeah.
Now, why would they only have one?
They wanted to show progression, and again, in the clinicals, they're measuring what patient's feedback is after one treatment, what patient feedback is after two, what patient feedback is after three. So this way, when we do launch a product, and again, what you had mentioned earlier, all of these devices are FDA-cleared medical devices with extensive peer-reviewed papers and clinical trials to support efficacy and safety for the patients in the consumer market. So when we show before and afters after 1 and 2, it's to be able to convey to the lay patient or the lay consumer, what can I expect? Well, we're showing you, and we're able to show it to you in a clinical trial, but now you have a before and after to be able to see, and that's our tone, texture, and pigmentation, what we call dyschromia, which is superficial sun damage.
That's a dramatic picture. We're going to have to kind of roll through these quickly because we're running out of time. Next slide is of a neck, and the nice thing about the Matrix, we can use it anywhere in the face or body. So you can see a tremendous improvement in the before and after of this patient's neck lines. Next slide. This is going to be of, well, why don't you describe this, because I'm not quite sure.
That is pore size all the way, and that's again one treatment.
It looks like she also has some rosacea.
Yeah.
And you can see when I mentioned Victoria Duke talking about how well makeup goes on afterwards, you can see in the slide clearly why her pore size is probably 80% reduced. Next slide, Freddie. That's a very similar picture.
Correct.
To the slide before. Again, showing a patient with a lot of redness, large pore sizes, and then afterwards looking at about a 70% decrease. Let's look at some acne scar pictures, because that's one of my favorites patients to treat. These kids sometimes come in with looking down and feeling bad about themselves. Mm-hmm. And our favorite patient is treating these 17 to 25-year-olds who have acne pick scars from their youth. And what a tremendous improvement we can make. Again, it's not a cure, but you can see in this picture before and after 2 treatments, about a 50 to 60% improvement in the depth and the texture of those pick scars.
Correct. And to be able to help with self-esteem at a pivotal age and time for a lot of adolescents, yeah, that's a game changer. That's beyond just vanity.
Yeah, that's well beyond vanity. We've had kids come in, and I say kids, again, 17 and 22-year-old kids who can't look you in the eye. They look down when they talk to you. When they come back after these treatments are done, they're different people. They're extroverted. They're like happy. So this can definitely be a life-changing experience for some of these kids. Another patient. This looks to be about an 80% improvement in the acne pick scars of this patient.
That is dramatic.
And that's 4 weeks post-treatment.
Correct.
Next slide, Freddie. Another great example, patient with acne pick scars, and you can clearly see for those in our TV, live TV feed, what a tremendous improvement this patient had. And this is 1 month post 3 treatments.
So we're looking at that after picture 4 months out.
Next slide. Now, this is impressive because this is a patient who has really, really deep acne pick scars. I don't know the exact depth, but these are severe. These are Manuel Noriega-sized scars.
Yes.
Now, Why did this patient have such a great response 1 month post one treatment? That's tremendous.
The old saying, youth is wasted on the young, so the younger you are, the more collagen.
Gotcha. Next slide. This is showing a person with some laxity improvement, especially in her submental area and under her chin.
Yeah, that's a big area.
Now, so how does this work for laxity? Is just the heat is causing the laxity improvement?
Yeah, it's a synergistic effect of not just collagen, but collagen and elastin together, so you're getting volume, but you're also getting a little bit more snapback in the area that we're treating.
Outstanding. And the last slide is of another patient with her neck, and you can see the tremendous improvement in those lines that go around her neck before and after one treatment.
Yep, that's the crepiness.
So thank you, David, for joining us today.
Thank you. A pleasure.
How can the listening audience get a hold of you if they have a practice, derm practice, plastic surgery practice, and they want to get a hold of you to talk about the E-Matrix or any of the other Syneron equipment? How can they get a hold of you?
Besides visiting any local cafeteria where I'll be drinking my Cuban coffee, it's 954-648-4505, and I've been with the company for quite some time, and I'm here to be of service.
David's outstanding. Again, thank you for joining us, David.
My pleasure.
And this wraps up another show for Forever Young Med Spa, our Simple Aesthetics radio show. Tune in next week. We're going to have another great show lined up for you. And until then, South Florida, stay dry.
Thanks for joining Brian Sedella, President and founder of South Florida's #1 medical aesthetics center, Forever Young Med Spa in Cooper City. Join us next week as Brian will again demystify the world of medical aesthetics and provide you, our listening audience, a non-medical opinion on what's hot, what's not, and what really works. You can contact Forever Young Med Spa at 954-450-2626 or visit our website at foreveryoungmedspa.us.